Hi, Jen here from MetaMed, and I'm one of the osteos that uses quite a bit of dry needling in my treatments. I probably treat about 95% of my patients with dry needling in conjunction with other therapies as well. And it's because I find it an incredibly effective tool, especially for tight muscles and pain. So I'm going to be talking about using it for those knots or the tight muscles and cramp. First of all, muscles usually have contraction and relaxation happening all the time, and it's maintained at an equilibrium that means that we get that nice relaxed muscle tone. But a knot is created when you get sustained muscle contraction, causing that knotty fibre, which can cause that ache sensation. And when it gets really tight, that's when you start to get the cramp. So I think of the needle like a reset, and you find the knot and you pop the needle into it. You can either settle it in there and it hums away, you might feel a little bit of an ache or a bit of warmth, or you can do trigger point dry needling, where you pop the needle into the trigger point and you work it until you get a twitch reaction. So the twitch is a strong muscle contraction and then a reflex relaxation around the needle. So visually we can see it as practitioners, and you will definitely feel it as the patient. Here are some of the sensations that people usually describe when they have had the trigger point dry needling where they get the twitch reaction. So the first one is the twitch, and because the needles also bring increased blood flow to the area, they may feel some warmth or maybe a little bit of an itching sensation because histamine gets released as well. The other thing is that the needles release lactic acid in the tissue, so especially if you've had multiple areas twitched out, you can feel that heavy lactic acid feeling like you've done exercise without any training. You can also feel quite tired after a treatment, particularly if you've had several areas needled or the tissues have been chronically tight and now they've been released, because your body is saying, right, I want to rest and I want to relax so that I can repair, deal with this inflammation and reset my muscle tone. Thirst is another common symptom because your body just wants to hydrate to be able to flush everything through. So it's really important that you listen to your body and the signs it's giving you after any treatment, but particularly after dry needling. And we always recommend that you don't have any alcohol within 48 hours of having needling treatment, because it's quite inflammatory and it can exacerbate the post-treatment reaction that you may have. Now, these symptoms get a lot easier over time. At the most, you will experience it for a couple of days, and it really depends on the health of your body. So if you're pretty fit and healthy, then you may just feel those symptoms for a couple of hours or maybe that evening of the treatment. But generally, we space the treatments out for chronic muscle tension a week apart in the initial stages, and that's to break the habit cycle that the muscles are in. So you'll usually feel a little bit sore, then feel better, and then it will slowly start to tense up again. And this is where we need to prescribe you certain stretches to do in between treatment to gradually change that habit pattern of the muscle. The reactions tend to get easier, and that is a sign for you that your muscle tone is improving and that you're making gains. So if you have any other questions about dry needling, it's amazingly effective for tight muscles and painful areas if applied properly. There is some minor side effects to it, but we'll usually explain that pretty thoroughly to you so you know what's coming.